Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Reduced Neuroanatomical Volumes in Long-Term Survivors of Childhood Acute Lymphoblastic Leukemia by Bernard Zeller and colleagues. My name is Deborah Weber, and I am Associate Professor of Psychology in the Department of Psychiatry at Harvard Medical School and Boston Children's Hospital. My specialty is pediatric neuropsychology. Although central nervous system therapy is essential to the successful treatment of acute lymphoblastic leukemia, or ALL, there has always been concern about cognitive late effects, especially in younger children whose developing brains may be more sensitive to toxicities than those of more mature adolescents and adults. The ability to provide effective treatment either without cranial radiation therapy or with lower doses of cranial radiation therapy has certainly led to improved outcomes in this regard, but has not eliminated the risk. The prospect of cognitive impairment, potentially lifelong, thus remains a lingering concern, especially for parents. One happy result of the great successes that have been achieved in the treatment of childhood ALL is the increasing numbers of long-term survivors, many of whom are now reaching young adulthood and even middle age. The cognitive functioning of these adult survivors, especially those treated without cranial radiation therapy, who would be expected to fare reasonably well, is of considerable interest. Moreover, some investigators are now raising concerns about whether these late effects might continue to evolve over time, possibly manifest as an acceleration in the normal processes of age-related neurocognitive decline. Adult survivors of ALL, therefore, have become a great focus of interest for researchers. It is within this context that the current study by Zeller and his colleagues, based on a large Norwegian sample, is both timely and potentially important. The investigators obtained MRI scans and neuropsychological outcome data from 130 adult survivors ranging in age from 18 to 46 years, and a healthy control group matched for age and sex. Although these survivors had been treated on a succession of protocols between 1970 and 2002 with a variety of treatment regimens, few had received cranial radiation therapy, about 14% of the total sample. The study reports three main findings. First, there was a significant reduction in the neighborhood of 2 to 3% in the volumes of structures throughout the brain, including gray matter, white matter, and subcortical structures, among the ALL survivors. Second, although the ALL survivors did not differ from the control group in their IQs, with mean IQ scores generally above average for a U.S. population, performance on tests of processing speed, verbal learning, and executive functioning, that is, planning and regulation, were all reduced among the survivors relative to the control group. Third, performance on a number of these neuropsychological measures was correlated with brain structural volumes, larger volumes predicting better performance. Thus, the observed structural brain changes had apparent functional correlates. Although there was certainly variability in outcomes in terms of both brain volumes and neuropsychological performance, the authors were unable to identify risk factors for these outcomes in terms of either patient characteristics, such as the age at which a person had been diagnosed or their sex, or treatment variables, such as cumulative drug dose or cranial radiation therapy. Thus, the study is unable to offer guidance for practitioners to help identify patients at increased risk for developing these late effects. The study is important for a number of reasons. First, the very large sample size, and especially the equally large healthy control group, is an impressive achievement for a study of this type. The larger the sample size, the more credence we can place in the findings. Thus, the findings from this study must be regarded as reliable and important. Second, although several studies have previously demonstrated effects of ALL therapies on white matter volumes in children and adolescents, the findings of this study reveal far more widespread impact on brain development, even in a patient population that was largely treated without radiation. It is not clear whether these more widespread effects were detected because this study had greater statistical power to detect differences than earlier studies, or whether they represent a progressive process that may be set into motion during childhood and continues to evolve later in life. If that were the case, earlier studies that focused on younger cohorts of survivors may have failed to detect these widespread changes. Finally, the study provides a much more comprehensive appreciation of the essentially lifelong impact of childhood leukemia, its therapy, and other associated factors on brain and cognitive development. Although basic IQ, meaning knowledge, reasoning, and problem solving, appeared to be intact in the ALL survivors, there were consistent differences on measures sensitive to basic information processing. What we cannot glean from these data is the real-life functional significance of the demonstrated neuroanatomical and neuropsychological deficits. We do not know to what extent these deficits affect aspects of day-to-day functioning that are relevant for quality of life. For example, do the differences demonstrated on neuropsychological testing and measures of brain volume translate to differences in metrics such as occupational or marital status, or to mental health? The childhood cancer survivor study, for example, did find poorer outcomes among adult ALL survivors on many such indicators, but upwards of 60% of that cohort was treated with cranial radiation therapy. Since cranial radiation therapy was a key predictor, the relevance to patients treated without radiation, such as those in the Zeller study, is not really known. Questions such as these were understandably beyond the scope of this particular study, whose primary focus was brain development, but they are nevertheless the ones that will be relevant for practitioners. Until studies are carried out that can link neuroanatomic and neuropsychological late effects, such as those reported by Zeller and his colleagues, to real-life functioning, it will be difficult to know how concerned we really need to be about these deficits, even though they attain statistical significance. For clinicians, the primary message of this study is that neurocognitive late effects are linked to changes in brain anatomy and will, for many patients, be a lifelong issue. Although MRI scans would not be indicated unless unusual behavioral symptoms or a precipitous decline in cognitive function were to occur, clinicians who follow adult patients should be alerted to the potential and even the likelihood that for some patients, childhood ALL and its treatment will lead to cognitive changes that can have lifelong consequences. Cognitive functioning and mental health should thus be monitored along with physical health, and physicians and nurses should be alert lest any decline or change in function emerge. In that case, the patient should be referred to a neurologist, neuropsychologist, or neuropsychiatrist for evaluation and follow-up. The lifespan consequences of childhood ALL and its therapy is a question whose time has come. This study makes a major contribution to our understanding of these issues, but further research should be undertaken to provide a more comprehensive understanding and to track the mental health and adaptive functioning of these patients as they continue to age. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.